health and beauty. EPIONE Center for Pain Relief experts in regenerative therapy, first of its kind in South India to do maximum number of regenerative therapy around 3,000 patients in 3 years and have presented them from going into surgery. To fully explain this, Dr. Meenal Chandra, consultant pain specialist in EPIONE Center for Pain Relief and Beyond, ask those who are in the studio with us and find out more details. Hello.
Hi.
Firstly, what is this regenerative therapy?
So, regenerative therapy is a super specialty branch in medical field where we extract patient's own blood and then we regenerate the tissue. It can be a muscle, it can be a tendon, it can be cartilage or any other part of the tissue. So, regenerative medicine have been in practice since a decade in India, but for various reasons like for hair regrowth or for skin rejuvenation. But for musculoskeletal pain like joint pain, mostly for knee pain, shoulder pain or any tendon injury, what we do is using patient's own blood, we extract the blood cells, we process it and then inject exactly into the area of damage. So slowly with the help of these blood cells and growth factors, these damaged tissue will regrow. So this is called as regenerative therapy.
So, okay. And most of the people, if you like when some ages like after 40s, they feel like this pain and all those. So most of the people like very scared to went for the surgeries.
Yes.
So you are telling this regenerative therapy is like a boon for them.
Yes, exactly. So the thing is, knee pain is very common. Firstly, what I would like to tell you is knee pain is something which every human has to go through. Why? Because knee pain, knee osteoarthritis is not a disease, it's a physiological condition. So as we are aging, in few cases it may start at 40s, but usually after the age of 50s the knee pain will start. So it's a slow process where initially you will be having pain while climbing the stairs and slowly you will be having pain even at rest. So what happens is there is a stage where you progress from stage 1 to 2 and then 3 and then 4 and where you have to undergo a surgery. So now regenerative therapy is an alternative to surgery where the patient doesn't have to go for any major surgical replacement surgeries, and with using the patient's own blood we can treat the patient's condition.
Okay. Actually, doctor, what are the causes you see in the knee pains like
Yes.
in people?
See, in old age when the patient comes to us, it is mostly it is knee osteoarthritis. So knee osteoarthritis is a condition where the cartilage between the two bones degenerate. Why? Because throughout our these many years the entire body weight is into the knee joint. So because of the wear and the tear, the knee cartilage wears off and so patient have pain. This is a condition of knee osteoarthritis. Similarly, we have like more than 100 types of arthritis, and very commonly the other type of arthritis like rheumatoid arthritis, psoriatic arthritis, spondyloarthropathic conditions. So there are lots of other arthritis as well, but the most commonly what we see is the knee osteoarthritis. This is what we see mostly in the geriatric population, that is the population more than 50 years of age. But now we are seeing a change in a trend where we see young patients coming with knee joint. So there are various other causes of young patients having knee pain. It could be because of early onset of knee osteoarthritis, could be because of an isolated ligament injury, meniscal injury, or because of a small bursitis or soft tissue injury. So there are lots of other reasons where we can have knee pain, which your treating physician should identify what is the cause of knee pain and then treat it. So the bottom line is not all knee pain is knee osteoarthritis. This is a very important statement, because what happens when knee pain starts, we think, oh, it's the start of arthritis. So we need to understand there are multiple causes of knee pain, and to get rid of knee pain we have to successfully identify the condition and then we can treat it.
In what cases this regenerative therapy is helpful and suitable?
Yes. See, regenerative therapy is suitable and helpful in almost all kinds of knee pain, whether it is knee osteoarthritis. In knee osteoarthritis, like I mentioned, the cartilage is degenerated. So this regenerative therapy, the blood cells what we extract will regrow the cartilage. Slowly the pain will go away, and then whatever stage of arthritis it is, it will be arrested in that stage. When it comes to an isolated ligament injury like an ACL injury or meniscal injury or any other ligament injury, regenerative therapy works wonder, because there are few conditions in which there is no other treatment, like you cannot undergo any surgery, so the patient have to live with the pain. So regenerative therapy using PRP and growth factors, this is the best, where we can heal your ligament, we can heal your tendons and joint cartilage. So like almost in all of the conditions, regenerative therapy will work like a wonder.
And like Meenal, when it comes to surgeries, in some cases we hear like if you want to go for the surgery, you need to reduce the weight. So for this regenerative therapy also, do those kind of cases apply?
See, weight, when it comes to weight, the weight adds one of the very potential risk factor for knee pain. So whatever modality of treatment you are taking, whether it's a replacement surgery or whether you want to go for regenerative therapy or whether you don't want to opt for any other treatment as well, reduction in weight is of prime importance. So it's not compulsory that you have to reduce the weight and then go for this treatment, but during the process, weight reduction would help you in getting better results.
Okay. I mean, like regenerative therapy is suitable for all ages?
Definitely it is suitable for all ages, but the processing of platelets, the processing of PRP differs. And what the literature says is the early cases, the early is the start of arthritis, the better it is, but definitely it adds in all the stages, like in all age group it has worked. So what in our center, 96 is the what we have treated patient of 96, and most of our patients, they belong to 70 to 80 age group. So it works in all ages, but yes, definitely the processing and everything differs.
Okay, how many sittings it takes? Like
Number of sittings and all will depend upon how much damage has happened into the knee joint. So to identify that, first we understand how much pain is there, then we do little examination of the knee joint. Once we identify how much is the damage, which grade of arthritis it is, and what are the other associated structures, how much damage is there, then we measure the cartilage, how much it is decreased. Accordingly, we plan for the number of sittings.
I mean, like treating 3,000 patients is not a less number. So what are the cases you find in more like in these 3,000?
Our main target is knee joint patient. Why? Because the population which suffers with knee pain is very huge. Like I said, knee pain is something which is not a disease, it's a physiological condition, like everyone has to go through. So in out of our 3,000, exclusively it is our knee pain. We have other conditions which we have treated, but this figure of 3,000 is of the knee joint specifically, mostly the geriatric population, and mostly those who have come with osteoarthritis, early stages and late stages as well. And we also have treated young patients with isolated meniscal injury, ACL injury, and other kinds of causes also.
And the success rate in regenerative therapy?
Yes. See, success rate, when we talk about success rate, it all depends upon how much the patient have in expectation. Like in out of 3,000 patients, we have almost like around 90 to 92% of success rate. Of course, there are 5 to 7% of failure, but we have lots of causes for it. Like, you know, the patient did not turn up, or the patient's expectation is different. So there are various other causes, but around 90 to 92% of success, what we have seen is in our patient.
And in people also, we hear this kind of statement more often, like once this knee pains or joint pain starts, it's very hard to get rid of it. Is it true, and how it will be in regenerative therapy?
Yes. See, definitely once the most important thing is, once you have realized that you have started with your knee pain, that is the time when you should take action in whatever form it is, whether you go for a physiotherapy consultation or with a consultation with a physician, but you should opt for a consultation, and then your treating physician can tell you that what are the treatment options. The early you start, the better it is. So because with knee joint pain, what happens, like initially it starts with pain, and then slowly stiffness of the muscles starts, and then the joint become restricted. So we should not reach to a stage where all these things, like, you know, will happen. So it's always better to treat it early for better success.
Okay. Though regenerative therapy is not new, but in India it is coming to limelight now.
Yes.
So how it is helpful, and what are the patient reviews you are getting?
Yes, like I said, we have this EPIONE Pain Management Center. We have the highest number of patients doing regenerative therapy. So we have almost 3,000 patients which we have treated of knee joint, and we have prevented them from going for major replacement surgeries. And like I said, the patient feedback is in form of like 90 to 92% of our patient population is really happy. They are doing well. We have in fact few patients coming on wheelchair and then walking. So we have lots of geriatric population of, like I said, more than 80 years of age group who cannot undergo surgery because of the medical condition, or who are because of scared of going for a surgical condition. So we have treated such patients and they are doing really well.
Even after a surgeries also, people has to face the challenges. Is that true?
Yes. See, what happens is after surgery there are lots of rehabilitation has to be undergone. But this is the advantage of regenerative therapy. Like when you come for the treatment, you can go back to your daily routine the same day. So there are, of course, there are few do's and don'ts which we explain to the patient, but those are very simple, minimal lifestyle modifications which the patient have to follow. And they can resume their work immediately on the same day. So there is no recovery time, and there is no complications. Why? Because it's your own blood. So regenerative therapy does not have any complications. So that is one of the advantage over major surgical surgeries.
Is this treatment needs maintenance?
Treatment needs maintenance. Like I said, yes, definitely lifestyle modification is a very important part which you have to follow. Then when it comes to a little of weight reduction, if you are overweight for your age or overweight, you need to have this weight reduction, which is very important. And of course, like, you know, some do's and don'ts which you need to follow is very important.
Whenever people are going for some treatment, like they definitely think of the relief after how many days I'll get the relief. So after how many sessions, at least minimum sessions, they can expect the relief?
See, immediately once we have completed the procedure, immediately there will be a good amount of pain relief. Okay, but I cannot tell you it will be 100% of pain relief, but definitely there will be good amount of pain relief. And slowly with each sitting there will be every sitting there will be continuous relief in the pain. And over a period of like 30 to 30 days, or of around 15 to 20 days, when the cartilage starts regrowing, that is the time when the patient will have patient will understand that what is the advantage of the treatment they are getting. So it's basically over a period of 15 to 20 days, 35 days, that you start getting the results.
And this treatment is like using our own blood to form our new cells, to create new cells. So is it like if that patient is suffering with some other diseases like sugar and some kind of things, is that suitable for those patients as well?
Yeah, see, the common conditions like those with diabetes, hypertension, cardiac issues and all those things, these patients have the same effect as a normal, those without any of these conditions. So these patients are completely safe to undergo PIP therapy. There are few conditions like those who have active cancers, or those who have a less number of platelet counts, or some other medical issues. These patients, for them the PRP may not work. So we identify this set of people where we cannot do the regenerative therapy. But otherwise, for the other medical conditions like diabetes, hypertension, all these patients are safe to undergo our treatment.
Okay. After this treatment, what kind of the precautions patient need to follow?
The patient, like I said, the patient needs to follow our do's and don'ts, little of weight reduction, and immediately they can resume their work. So there is no as such any precaution which the patient needs to take, except for few lifestyle modification like how much to walk, when to walk, how much to climb. Those all things we tell how to do it. But there is no restriction in any other activity.
Like food habits and everything, they can continue as like before?
Yes, there is no restriction with food, there is no restriction with anything, but the only thing is weight reduction in whatever form may happen is a good thing, may add to the success of our treatment.
Do it have any side effects?
See, it's your own blood. We take patient's blood, we process it and then inject it into the area of damage. So this is one procedure in medical field where we can say that we don't have any complications by and large. A minimal of complications like a minimal of pain or sometimes a small reaction, those are very minimal and chances are like less than 1%. So by and large there is no major complication, no major or minor complications with this PRP therapy.
Okay. After one age, like getting knee pains are like common and we don't consider it as big issue, but in when small ages, young people also these days we are seeing. So what are the causes in their?
See, what happens is now what we are seeing is patients, very young patients, like in sometimes in early 30s and in 40s as well, patients are starting with knee osteoarthritis. This could be because of the genetic condition or also because of the lifestyle modification which has happened over a period of 20-30 years, in the last 20-30 years. And then we are also seeing a lot of sports are coming into picture these days. So lots of patients play sports. So all these things play a very important role. So isolated ligament injury, like a meniscal injury or ACL injury, or like even a small bursitis or even a small soft tissue injury are very common. So along with osteoarthritis, these are the other causes of pain in young patients which we need to identify before we tell them what's wrong with them.
Mostly when feel like pain, we like used to like rest it for 2 days, 3 days. So when should we consult the doctor?
Yes. See, when you have started with your pain, our tendency is, we try to put a hot bag, cold bag, we take a painkiller and then we rest. So if the initial 2-3 days, if you get the rest, it's okay. But if the frequency of such episodes increases, if your pain is so excruciating that it's hampering your daily activities, this is the time that you should seriously seek your physician's help.
Okay. And why should a patient should choose EPIONE Center?
See, EPIONE, we have the highest number of doing the regenerative therapy, where we have treated more than 3,000 patients of knee along with other conditions. Okay, and the very important point for the success of regenerative therapy is the preparation of the regenerative, how we prepare the platelet and how we prepare the growth factors. So in EPIONE, whatever machines, whatever technique we use is all FDA approved, is all according to the guidelines, according to the Western system. We have our protocols. So it's not just taking the PRP and injecting into it, it's the amount of PRP, it's the concentration of platelets, what we are preparing is very important. So we have our own lab test where we have over a period of time where we have conducted our own test and we have extracted a formula where we prepare the PRP in such a way that it is more than 5 to 7% of the normal value, and then we inject it. And second very important point is injecting of PRP. Like I said, knee joint is a big joint. You cannot inject your growth factor anywhere. It has to be exactly at the area of damage. So we have specialized machines in form of ultrasound machines and fluoroscopic and other machines which will guide us exactly to the area of damage. So injecting and preparation is very important for the success. And another thing is we follow the protocols, according to the protocols, according to the guidelines of FDA and DCGI. We have the machines and we use these machines, giving good results. So that's why EPIONE is like giving, we believe in giving results, not just doing the procedure. So that's the reason that we do everything according to guidelines.
Okay. And this regenerative therapy is only suitable for knee pain, or else we can go it with any other joint pain?
Yes. So regenerative therapy is gives success to lots of other conditions, like it could be knee osteoarthritis. Similarly, could be osteoarthritis of other joints also, like shoulder joint, hip joint, elbow joint and ankle joint. Then we have avascular necrosis of hip joint, which is very common even in young patients. So avascular necrosis of hip is one condition where PRP is working, like giving good success. Then we have rotator cuff injury in the shoulder. We have any tendon injury, any tendinitis. We have conditions like something called as tennis elbow. Then we have plantar fasciitis. So these are very common conditions, and the thing is the patient suffers a lot without getting good relief. So these are the conditions where PRP will help and will give permanent relief.
Okay. What is the entire process of this treatment?
This regenerative therapy is done as a daycare procedure, and once we have done all our protocol, we have followed all the procedure, and we have fixed a patient for PRP therapy. So the patient has to come to us, be in our clinic for around 2.5 hours. We extract the blood and then we keep it for processing in a specialized lab, and once the PRP is prepared, we immediately inject this into the area concerned, and this we do in our operation theatre under our specialized machine. Post procedure, we just tell what are the rehab which has to be done, with what are the do's, don'ts and everything, and then we discharge the patient. So the patient has to be with us for like 2.5 hours altogether in our clinic. Patient can go back. Lots of young patient comes to us who go back to their office the same day, and they can resume their work.
Okay, as you said, like some hours, few hours, patient has to stay. Is this after session? Do he need to stay for some time in hospital, like to see the reaction or anything?
We observe the patient, definitely. We observe the patient with us for half an hour to 1 hour, and then our team, we have a lot of team of physiotherapists and rehab specialists, occupation like therapists who will take over, who will understand and then tell the do's and don'ts. So observation is for like 30 to 45 minutes in our hospital.
Okay, tell something, few things about the EPIONE Pain Management Center.
So EPIONE Pain Management Center is like a state of art where we treat all types of chronic pain. So this word EPIONE means goddess of pain relief, and this center we have started in 2018, and since then our main aim is to treat all patients of chronic pain. So the incidence of chronic pain in normal population is somewhere around 30 to 40% of population, where they don't seek any help and they are asked to live with this pain. So we treat such kind of pain by identifying what is the cause of pain. The most important thing is to identify what is the cause of pain. We identify the cause of pain, and then with various techniques, we have like regenerative therapy, we have minimally invasive procedures, we have all sometimes only with physiotherapy and medication, or with other procedures, we treat all types of chronic pain. So whether it is a sciatica pain or any neuralgic pain like trigeminal neuralgia or migraine for that cause, spondylitis, we treat all types of pain.
How is it is better than surgery?
See, the condition what we treat, most of the condition will not have any surgical alternative for it. Like I said, if you have a tennis elbow, there is no surgery for it. Like if you have plantar fasciitis, people live with this kind of pain. So always opting for a non-surgical treatment which gives you results similar to that of the surgical option, and also with minimal complications or no complications. So that is why, and the post-operatively, post-procedure, there is no sitting back at home, or you don't have to stop your work. So you can resume back to your work immediately with little modification. So that is why this is much better than any surgical intervention.
What age people you see more oftenly in your clinic?
We have patients of knee pain, we have patients of shoulder pain. When knee pain come, it is mostly a geriatric population of more than 50 years. We have young patients who play various kinds of sports and they have their rotator cuff injury coming with shoulder pain. We have lots of patients with spine pain, low back pain, neck pain and ankle pain. So various types of conditions we treat, and of course cancer pain is one where a patient suffering with cancer have severe excruciating pain. So we have various techniques to take care of such kind of pain.
Okay, finally a few words about the regenerative therapy.
Regenerative therapy is it's very new in India for musculoskeletal pain, but the results what we see is much better. We don't need young patients or old patients to undergo any surgical intervention. Using their own blood, patient can have the same amount of success, the same amount of pain relief what a surgical intervention will give without any complication. So I think regenerative therapy is a boon which Indian population should now take advantage of without undergoing any major surgical complication, without stopping their work, without hampering their daily activities.
Right. Thank you, Meenal Garu. You have given very good things and important things to the people to know about more about this regenerative therapy. Thanks for being here.
Thank you.
It's all now. Hope you have more information about regenerative therapy and keep watching iNews.